Do you struggle to have a bowel movement or feel sharp pain when using the bathroom? Have you noticed blood in the toilet bowl, or perhaps your stool has become unusually hard, pitch black, or frighteningly thin? If you are over the age of 50, I need you to listen very closely. As a doctor with over 10 years of clinical experience, I am issuing a clear warning right now. There is one specific type of stool that is the absolute worst sign for your health. It is a red flag that you must never, ever ignore. Today, we are going to have a very uncomfortable but potentially life-saving conversation. We are talking about what happens in the bathroom. I know it's not polite dinner table conversation, but the toilet is exactly where the first warning signs of colon cancer and severe internal bleeding show up. And the tragedy is, most people simply flush those warning signs away without looking. By the end of this video, you will know exactly which stool changes indicate cancer. You will understand when blood in the stool is a medical emergency that requires an ambulance, and when it might just be a hemorrhoid. We are going to discuss the dangerous link between chronic constipation and intestinal tumors, and I will give you the specific natural remedies that can help relieve that pressure and reduce inflammation in your gut. Please do not click away. Your health, and quite literally your life, may depend on what you see the next time you go to the bathroom. If this information helps you, or if you know a senior who needs to hear this, please like this video and share it. We need to break the taboo and start talking about this. Let's start with the most alarming sign, the one I mentioned earlier as the worst type of stool. It isn't what most people think. Most people see bright red blood and panic. While red blood is serious, which we will get to in a moment, the most dangerous stool is often pitch black. I am talking about stool that looks like tar. It is sticky, it smells absolutely terrible, much worse than normal stool, and it is jet black. This is medically known as Melena. Why is this so dangerous? Because that black color is actually blood, but it is old, digested blood. This tells us that you are bleeding heavily from somewhere high up in your digestive tract, like your stomach or the upper part of your small intestine. By the time that blood travels all the way through your intestines and comes out, digestion has turned it black. If you see black, tarry stool, this is not a wait-and-see situation. This could mean you have a bleeding stomach ulcer, severe gastritis, or even a tumor in the upper GI tract. In seniors, this can lead to rapid blood loss, anemia, and shock. If you see this, you need to see a doctor immediately. Now let's move to the second major warning sign, the shape of the stool. Have you noticed that your stool has become very narrow? We call this pencil stool or ribbon-like stool. Imagine your colon is a flexible tube, like a garden hose. If everything is healthy, the stool passes through easily and comes out in a standard round shape. But what happens if a tumor starts growing on the inside wall of that hose? It starts to block the path. As the stool passes by that tumor, it gets squeezed and flattened. It's purely mechanical. If your stool is consistently coming out thin, like a pencil or a flat ribbon for more than a few days, that is a classic sign of a partial obstruction. In older adults, we have to assume this is a polyp or a mass in the colon until proven otherwise. Do not assume it's just stress or diet. If the shape changes and stays that way, your colon is telling you it is running out of space. Next, let's talk about the blood you can see easily, bright red blood. This is frightening. You look down and the water is red or there's blood on the tissue. What causes this? In seniors, we have a few culprits. The most common is hemorrhoids. As we age, the tissues supporting the veins in the rectum get weaker and they can bulge and bleed. However, and this is the critical part, you must never diagnose yourself with hemorrhoids. Why? Because rectal cancer bleeds too. I've had too many patients come into my clinic saying, "Oh, doc, it's just my hemorrhoids acting up again," and they let it go on for 6 months. When we finally looked, it wasn't a hemorrhoid. It was a tumor sitting low in the rectum. Here's a rule of thumb. If the blood is mixed into the stool rather than just coating the outside, that suggests the bleeding is coming from higher up. If you see maroon or dark red clots, that's also a sign of a deeper issue like diverticulosis or a polyp. Diverticulosis is very common in seniors. These are small pouches that form in the lining of the colon. If one of those pouches bursts a blood vessel, you can have a sudden, large amount of blood. It's usually painless, but it is shocking. So, when does blood become a medical emergency? If you are passing large amounts of blood, if you feel lightheaded, dizzy, or if your heart is racing, call for help immediately. These are signs that you are losing blood volume faster than your body can handle. Now, I want to address something that affects millions of seniors: chronic constipation. Do you struggle to go? Do you have to strain? Is the stool hard and rocky? We often dismiss constipation as just a normal part of aging. Oh, things just slow down. While digestion does slow down slightly, severe chronic constipation is not something you should accept. There's a dangerous link here. When you are chronically constipated, waste material sits in your colon for a long time. This exposes the cells of your colon to toxins and carcinogens in that waste for long extended periods. Furthermore, a sudden onset of constipation in a senior who has always been regular is a huge red flag. If you used to go every morning like clockwork and suddenly you can't go for 3 or 4 days at a time, your body is signaling a change. A tumor can physically block the passage of stool, causing a backup. This leads us to the pain. Do you feel pain when using the bathroom? Pain can be caused by an anal fissure, which is a tear in the lining, often caused by passing those hard, rock-like stools. But deep, cramping abdominal pain that gets worse when you try to move your bowels can indicate a blockage or severe inflammation. So what can we do? How do we protect ourselves?
First, we need to talk about early detection. The gold standard is the colonoscopy. If you are over 45, or certainly if you are over 50 and you haven't had one, get it booked. I know the prep is unpleasant. I know the procedure sounds invasive, but remember this: colon cancer usually starts as a small polyp. It takes years to turn into cancer. During a colonoscopy, we find that polyp and we snip it out right there. We literally prevent the cancer before it starts. It is one of the few cancers we can truly prevent just by screening. But what can you do at home, starting today, to improve your stool health and lower your risk? Let's talk about natural remedies and lifestyle changes that actually work for seniors. Number 1 is hydration, but with a caveat. As we get older, our sense of thirst diminishes. You might be dehydrated and not even feel thirsty. Your colon works like a sponge. If you are dehydrated, your body steals water from your colon to keep your blood pressure up and your brain working. That leaves your stool dry, hard, and difficult to pass. You need to drink water throughout the day, not just when you are thirsty. Number 2 is the right kind of fiber. Everyone says eat more fiber, but for seniors, you need to be careful. If you just pile on dry, rough fiber like wheat bran, but you don't drink enough water, you will actually make the constipation worse. You create a concrete block in your gut. Focus on soluble fiber. This is the fiber found in oats, apples, pears, and beans. Soluble fiber absorbs water and turns into a gel. This gel helps the stool slide through the colon easily. Prunes are a classic for a reason. They contain sorbitol, a natural sugar that pulls water into the intestines to soften the stool. 3 to 4 prunes a day can work miracles. Number 3 is movement. The colon is a muscle. If you are sedentary, your colon becomes sedentary. A simple 20-minute walk every day helps stimulate the peristalsis, the wave-like contractions that move food through your system. Number 4, consider magnesium. Many seniors are deficient in magnesium. Magnesium helps relax the muscles in the intestines and also draws water into the bowel. A magnesium citrate supplement can be very helpful for occasional constipation, but always check with your doctor first, especially if you have kidney issues. Now, I want to circle back to the warning signs because repetition saves lives. I want you to become a detective of your own body. I want you to adopt the look down habit. Every single time you go to the bathroom, before you flush, take 3 seconds to look. Ask yourself 3 questions. 1. Is there blood, red or black? 2. Is the shape normal, or is it thin and pencil-like? 3. Is the consistency right, or is it hard rocks or liquid? If you see a change that lasts for more than 2 weeks, you make that appointment. Do not be embarrassed. Doctors have seen it all. We talk about stool all day long. We don't care about the embarrassment. We care about finding a tumor while it is still small enough to cure. Colon cancer is the 3rd most common cancer diagnosed in both men and women in the United States, but it is also one of the most treatable if caught early. The survival rate for early-stage colon cancer is about 90%, but that drops drastically if it spreads. The difference between those 2 outcomes is often just a person noticing something weird in the toilet and picking up the phone. Let's also touch briefly on iron supplements. Many seniors take iron for anemia. I mentioned earlier that black stool is a danger sign of bleeding. However, iron supplements can also turn your stool black and tarry. It's a common side effect. So if you just started taking iron and your stool turns black, don't panic, but do mention it to your doctor to be sure. If you are not taking iron and it turns black, that is the emergency. Also, pay attention to weight loss. If you are losing weight without trying and you have any of these bowel issues, constipation, diarrhea, or blood, that is a very strong indication of a malignancy. Cancer consumes the body's energy. Unexplained weight loss combined with stool changes is a major red flag. To summarize, your digestive system is a window into your overall health. If you have black, tarry stool, bright red blood in the water or on the paper, pencil-thin stools, persistent abdominal pain, or a sudden change in your bowel habits that doesn't go away, please get checked. I want you to live a long, healthy, and active life. I don't want you to be a statistic. The power is in your hands and in your observations. Don't ignore your body. It is talking to you. Listen to it. If you found this information helpful, please hit that like button. It helps this video reach more seniors who need this warning, and subscribe to the channel for more straight-talking health alerts. Now, I have a question for you. Have you noticed changes in your digestion as you've gotten older? Let me know in the comments below. Sharing your experience might encourage someone else to seek help. Thank you for watching, stay vigilant, and I will see you in the next video.